So, good afternoon, everyone. Thank you so much for joining today's session. My name is Varun. I head hospital success team at Medlearn. Medlearn team is again excited to connect with you all in its popular series of industry expert sessions, where we ensure that healthcare professionals get an opportunity to interact with seasoned leaders from healthcare. I welcome you all in today's webinar on patient-centered care, a pathway to safety and satisfaction. This webinar is organized on the occasion of World Patient Safety Day, which was observed on 17th of this month. So before I introduce to our esteemed speaker for today's session, we would like to give you a quick brief about Medlearn on what we are, what we do. I request Subhashri to kindly play the video for us. Thank you.
Hospitals work round the clock to serve patients. Being at the center of the action, hospital physicians and staff must confront every situation and every challenge. They must also keep up with evolving health needs.
Subhashri, the audio went off.
To serve patients. Being at the center of the action, hospital physicians and staff must confront every situation and every challenge. They must also keep up with evolving health needs and knowledge through ongoing comprehensive training programs. What they need is a promising solution to ensure a continuous learning journey.
In today's world, technology is transforming life. Be it taxis, food delivery, everything we need is at our fingertips. Education is also going through a transformation, and we are at the forefront in the healthcare industry.
Medlearn is a comprehensive learning, training, and skill development tracking of the real-time status of their learning progress. What's unique about this platform is that it's accessible anytime, anywhere, ensuring quality learning literally at your fingertips. Hospitals can now assign courses and track the competencies of users on specific topics with Medlearn's intelligent assessment tool, which gives them better administrative control. Its superior courseware helps hospitals provide standardized care and bridge skill gaps at every level in the organization. The healthcare professionals will also become more efficient and empowered when their learning journey progresses with ease and at their convenience. Let us unite to improve healthcare in India by spreading knowledge through technology. Medlearn, better prepared for better care.
Thank you, Subhashri. So now it's the time to introduce our speaker for today's session. I would like to welcome Dr. Anshu, who is currently working as a Chief Quality Officer at American Accreditation Commission International India. Medlearn team is privileged to have ma'am as a speaker. Dr. Anshu is a seasoned healthcare professional with more than 8 years of experience in healthcare quality management, hospital accreditation, medical administration. She holds an MBA in hospital management Her expertise seamlessly blends clinical understanding with strategic administration, offering comprehensive solution to healthcare challenges. Her meticulous approach has shaped quality assurance and guided facilities through NABH and JCI accreditation. So she has steered over 10 institutions in a span of less than 3 years, which is a great achievement with 100% JCI accreditation rate by enhancing patient safety, staff training, operational efficiency, a testament to her unwavering commitment to excellence. I have personally witnessed Dr. Anshu's excellence and what a fantastic speaker she is. So I am sure that at the end of today's session, everybody is going to have sufficient key takeaways on how they have to shape, design, and streamline patient safety approach in their own healthcare organization. So I welcome you all once again on these sessions. At the end of this session, we will have a Q&A with ma'am, and you can type your questions, your queries in the comment section, and we would be taking the questions after the session. So once again, welcome, Dr. Anshu, and over to you.
Thank you, Mr. Varun, for this wonderful introduction, and uh, thank you, the entire Medlearn team, for giving this opportunity to talk about this topic that has been chosen for the World Patient Safety Day. And welcome to all the listeners that they have taken time post lunch sessions, must be working at their organizations, and post lunch sessions seems to be a little something we don't want to hear talks and all, but I would try my best to get the maximum of this topic and with more of interest, and that's why I've added a little more of videos. We'll have a question and answer session as said at the end of the session, and hope that you enjoy, and please give us the feedback so that we can also learn and improve ourselves. So to start with, we'll start with our slides. I hope I'm audible. If any issues, please put in the chat box or just raise your hands. So the topic for today is everybody known as, and Mr. Varun has said, patient-centered care, a pathway to safety and satisfaction. The reason for choosing this topic was when we were discussing that it was because of the World Patient Safety Day that was celebrated on 17th September, and it is celebrated every year on 17th September. And this topic directly correlates with the theme of the World Patient Safety Day that WHO has taken, which I will show you in my next slide. Next slide, please. So this time, the World WHO has selected the theme Elevate the Voice of Patients. WHO celebrates this day as on 17th September every year, but they select the theme every year differently based on their assessment of what's the need of our for the healthcare, not only in India but worldwide. So last year they had a theme on medication safety, and now they have called on the theme for engaging the patients for patient safety, because this is very crucial in this coming era all over the world, the role of patients and families in playing an important role in safety of healthcare, and not only for the patients. So the theme says engaging the patients for patient safety, because a lot of evidences have shown that patients who are treated as partners in their care, the significant gains are made not only in safety and patient satisfaction but also on health outcomes. So it is not a benefit only to the patient but also to the healthcare organizations. Thus, the slogan says elevate the voice of patients. WHO has called on for all the healthcare stakeholders across the world to ensure that the patients are involved at every steps in the healthcare by designing the strategies, mechanisms, and making them as an active partners in their own care. If they are healthy, the nation is healthy, and there's a less burden on the entire community. And how this can be achieved? This can be achieved by providing platforms and opportunities for diverse patients, families, and communities to raise their voice. I think most of you must have seen it, but to begin with my presentation, please look in this video, and this will make you understand what we'll talk about next in our presentation. The video, please.
Something just didn't feel right.
We had so many questions.
They didn't listen to us again and again.
No one told me what went wrong.
We all have the right to safe healthcare.
Each one of us.
Most of the harm caused to patients can be avoided.
Safety starts with us.
We have the right to ask questions
and to get answers.
To express our opinions and concerns.
To know if something went wrong in my care.
When I include patients and families as members of the health team,
care becomes safer.
When I listen to my patients.
When we are transparent.
When we learn from patients' experiences.
When we make decisions that include patients' voices.
When we partner with patients and families.
We save lives.
When I am heard, I can make a difference in my own care.
And the care of others.
Together,
we can achieve safer healthcare.
For everyone.
So what we saw in this video, that if both the patients and the doctors come together, they can deliver a best care with the best patient satisfaction as well as best clinical outcomes. And that is what is called a patient-centered care, which is the topic for today's session. So how this is related with this Patient Safety Day. Going forward, I would like to start with my topic, with the definition. If you talk about the definition of patient-centered care, in the lay term, I would call it as patient-centered care is the practice of caring for the patients in ways that are meaningful and valuable individual patients that we saw. If we talk about the definition which is given by the Society of IOM, which is International Institute of Medicine, they call patient-centered care or PCC a care that is respectful of, responsive to individual patient preferences, needs and values, and ensuring that patient values guide all clinical decisions. That's what we saw in that video. Next, please. Also, treating patients as partners and not only patients, and involving them in their healthcare and encouraging them to take the responsibility for their own health. As you saw in the video, one elderly person is saying that if I can take care of my own self, I can take care of the others. So this is what is called patient-centric care. And then help your patients become decision makers who take an active role in their own care. If they are healthy, they will make this country healthy and the healthcare organizations also with the better clinical outcomes. Next slide. So to talk about next, what is the basic structure of patient-centered care? I would talk about that. So it basically expands on the model of disease-oriented model. Definitely, we are talking about patient care. There will be a disease. That's why a patient has come in for any consultation or admission. But we have to incorporate that disease plus the experience of the patient illness and also include their psychological context and involve them in the decision making at every aspect. This holistic approach makes this as a patient-centered care. So if you can see down, there's a small thing which says a patient's family, a healthcare team, and healthcare instruction. Together makes a holistic approach for a patient-centered care. So the process of healing depends on knowing the patient as a person in addition to accurately diagnosing their disease. So only diagnosing the disease will not help to get the good results. But if you know the patients well, their psychology, their spiritual values, their beliefs, their cultures, and then treat them, definitely it will help us to give them a better care and better clinical outcomes. So to make you understand before going too deep, again I'd like to show a video because I always believe the more you see visually, the better you understand rather than just reading onto the slides. That's my concept. So just see to it.
Let's talk about person-centered care. Kindness and respect mean different things to different people. That's why it matters to be person-centered. Being person-centered means thinking about what makes each person unique and doing everything you can to put their needs first. It's all about working with instead of doing to. Working with a person will help you tailor their care and motivate them to take part in it. The code also highlights your professional responsibility to make sure people's rights and best interests are at the centre of your decision-making, especially when people are at their most vulnerable. How do we do this in practice? We can't be person-centred if we don't know what's important to each person. So it's about making time for people. Time to see the whole person, not just the condition or illness. And time to think about their wider needs, social, psychological or spiritual, as well as their health and well-being. Good communication is important too, because some people find it easier to talk than others. One person will speak clearly and confidently, while another might need your support. If they don't speak your language or have an impairment, you'll need all your excellent communication skills to help them to share what's important. Then you can plan care with them in a person-centered way. What if it's busy and there's no time? We know it can be easy to see the long list of tasks before you see the person. But even moments of reassurance, a quick smile or a kind word, can make a difference to someone's well-being. If you're really stretched, let the person know why you can't give them more time right now, and that you or someone else will make up for it later. And if you're handing care over to someone else at the end of a busy shift, let them know when you've not had time to properly engage with the person. In difficult, busy circumstances, there's a higher risk you won't get something right for a person. Be open and honest when you've made the wrong assumptions about a person's needs. Don't delay in saying sorry. Reflecting on each person and learning what works for them will help build their trust and confidence in you. That's why being person-centered leads to even better care. Next, we'll talk about end-of-life care.
We can stop it here. So I think this video spoke everything in a crux that I wanted to talk to. That if we see how even a small communication or a gesture of help or a smile takes care of the patients well, everything go well. And it gave you the basic concept of patient-centered care, which I told you in definition that it's partnering the entire holistic approach, not only just the disease. So if somebody tells you in future what's patient-centered care, I would just tell you, just remember the 4 C's and you are go through. So just learn about these 4 C's for patient-centered care. Communication, we saw right now in the video. Culture, yes, every person has its own cultural and religious values and beliefs that we need to take care of. Then care, definitely it's very important. And last but not the least, collaboration. So everybody coming together and giving the care to the patients will give the best care. So what are the 4 C's which make the patient-centered care? Communication, culture, care, collaborations. And then if you implement these 4 things, you are approaching towards a patient-centered care and giving the best care to the patients. Next. So now I would like to show this video because just identify the missteps, because I was talking about the communication. Just see and relate yourself or any relative of yours who has gone into this situation in a hospital. And just after the question answer session, we'll talk about it. So identify the missteps and then we'll discuss later. Please, on the video.
So, what's your problem today?
My stomach has been hurting a lot. I've been throwing up all day. I can't keep anything down.
Do you take any pain medications?
I take 2 Lortabs 4 to 6 times a day for back pain, but it doesn't seem to be helping my stomach at all.
Do you really take that much? All right, so the doctor has ordered a CAT scan and some labs. And labs really take a long time, so you're going to be here for a while.
Can I have some water?
No, you can't have anything to eat or drink here. You're in PO. Hello, my name is Jim, and I'm going to be your emergency room nurse today. What do you prefer to be called?
Susie.
All right, Susie. I understand that you're having abdominal pain today?
Yeah, it's been hurting since this morning. I've been throwing up all day and I can't keep anything down.
I'm sorry to hear that. Do you take any medications at home, including pain medications?
I, take 2 Lortabs every 4 to 6 hours for back pain, but it doesn't seem to be helping my stomach at all.
Okay, let me confirm this. So you take Lortabs 2 every 4 to 6 hours as you need that for back pain, okay? I also see on here the physician has ordered a CAT scan and some lab work based on your symptoms. So somebody from the lab will be in to draw your blood and I'll transport you over to take you to CAT scan.
Can I have some water?
Right now, based on your abdominal pain, and we need more information, so we don't want to eat or drink anything on the offside chance that you may have to have a procedure. If you were to eat or drink, it could delay your care. So I'm going to give you a call light. If you need anything at all, just be sure to hit your call light and we'll come in, okay?
That's it. So I hope everybody understood that a small communication made so much comfortability to the patient. So that's how the building approach happens. So the 6 interactive components that we talk about for patient-centered care are, again, first of all, exploring the disease, both the illness and the experience. Every patient has its own experience with the disease. If I have a stomach ache, I can bear the pain, but the other person with a small pain cannot bear it. So we have to understand the illness as well as the experience. Secondly, as I've been repeatedly saying, that understanding the person as a whole, not only the disease, understanding their spiritual, their cultural beliefs, their physical environment, any past emotional journey that they have gone through. Thirdly, finding a common ground regarding management. So there has to be a consensus between the healthcare provider and the patient on the definitions of the problems and what are the priorities. If somebody is saying that I have the stomach ache, we have to understand that. Or any other priorities, we have to be mutual and collaborative and make them understand. Secondly, what will be the goals of the management or the treatment, what we are going to do with the patient should understand and mutually agree to it, which will help him satisfy more, rather than just you saw in the video, I'm just going to do this, that's it, you can't drink water, that's it. But when we explain them that why I'm not allowing you to drink the water, it's for your good health, it's for your benefit, that's make a difference. Mutually exploring the roles to be assumed by the patient and doctor. So you have to agree to a consensus in the mutual role in today's era where the patients are also very much aware. The fourth component talks about incorporating prevention and health promotion, which is very, very important in today's time. Proactive information to the patients that how they can be healthy after getting discharged from the hospital or even after a consultation, how we can explore or give them the ideas of how they can be healthy with their dietary consultations, with an exercise consultation, how they can enhance their health, how they can go for some investigation for early detection is the goal for patient-centered care. The fifth component would be talking about the patient-doctor relationship, which everybody understands here because all of them are from the healthcare industry, being into administration or nursing or from the various different managerial or non-managerial roles. That doctor-patient relationship is very, very important. Even if when we become a patient, if we have a good relationship, that's where our healing starts. That's why there used to be a saying in olden days, कि हमें तो वो डॉक्टर बस देख के ही हम ठीक हो जाते हैं. There's nothing that I have to say and I get healed. So that's what the doctor and the patient relationship is. So that's what the trust and respect used to be earlier, and now again that has to be there, but in a more approachable way. And last but not the least, being realistic. The doctors have a lot of patients. Patients have also become very time bounded. They come, they take appointments, they have to be very fixed, and they have to see the patient doctor in a very short time. So the time management has to be very good. The resources has to be appropriate, and then there has to be a team building from the healthcare professional, because every patient has its own needs. If a patient has just come for a general physician consultation, it'll just take 5 minutes. But if a patient is on dialysis, you think, patient will have to first have to interact with the doctor. He has to go to the dialysis room. He has to interact with the dialysis nurse, with the dialysis technician. A dietitian will come. Maybe a physiotherapist may come if he is having any problem in the moment. So there's a team building which requires to give that holistic care to a patient who has just only come for a dialysis. So that's what makes a team building, to give that collaborative approach treatment to a patient. Next slide, please. So that's what I saw this beautiful line, that there's a skill required in interviewing to enable a doctor to enter into the patient's world, and not only entering into the patient disease. Disease, definitely they are the best in diagnosing, but there are very good doctors that get into your own world and understand the patient as a whole. Next, please. So that's how a beautiful approach that I would call it. So there's a one nurse or a one healthcare provider taking a patient. So what is his benefit of this care? That he can make the personalized care plans for every category of patients, as I said, whether he's a dialysis patient, a long-term patient, or palliative care patient, or a general patient. He can focus on wellness and a disease prevention, and then he gets a convenient access based on these care plans. And what the patient will get benefit out of this approach that we are talking of? Can you just click enter? Next, yeah. Next. So what the patient will get out of it? They'll get support and resources for self-care, because the healthcare worker has helped him out to take care of his own self. There'll be a coordinated care among the team members, and definitely performance improvement and a better clinical outcome that a patient will get out of this. Yes, next. If I'm going very fast, very slow, please feel free to give a feedback. So patient-centered care has been 8 principle which is given by Pickers. So he was the person who developed these principles and collaborated into 8 pointers. So these are called as Pickers 8 principles of patient-centered care. So what are these principles and what they talk about? I would like to tell you, and then after this I would like to take you the video which will explain you that how actually this impacts a patient's journey and how we can help them out. So first is respect for patient's preference. We all know about, we are all taught when we are going to a hospital what are patient's rights and responsibility. I think everybody will agree that's a mandatory induction topic for anybody who enters a hospital. So we have to definitely respect for the patient preference, their decision making, their individual needs. They need to be treated with dignity, respect, and sensitivity. Second principle talks about coordination and integration of care, that we've already talked about, that it's not only the clinical care given by the doctor, but all the ancillary and the support services, nursing, dietitian, physiotherapy, diabetic educators. Nowadays, clinical pharmacologists are coming, nurse educator, pain nurse, all kind of ancillary services, including F&B also. The person who comes, delivers the food is also very important. And then frontline patient, who are our frontliners, our patient care executives, who guide us through the admission processes. Third principle talks about the information and education to the patient on their clinical status, prognosis, and progress, how their care is processing, and to facilitate the autonomy, that they can also help in participation, and they can participation to understand so that they can take care of themselves, self-care, and they can promote their own health if they are involved in information and education on regular basis by healthcare professional team. Fourth principle talks about physical comfort. It's very, very important if the person who is in the hospital or health comes is comfortable. Half of the disease, they say, will get settled or the anxiety will get cured if they are comfortable. So if the pain is reduced, they are assisted properly with the proper aids, and if the hospital surroundings and environments, as you saw in the video, a small smile, a small hand shaking, a small introduction, that entire environment makes them feel happy that they're not in a hospital, but yes, there are people, make them feel at home away from home. Fifth principle, next slide please. Yeah, talks about the emotional support. I hope you all are from the healthcare industry and people who are at long term or even short term. Even when our near or dear ones get into a hospital, we become very panic, anxiety, and then emotional adrenaline rush around us, and we become so anxious. And if somebody comes and talks to us that, can I help you? Or I'm there for you, actually heals us and helps us happy, not only to the patient, even to patient family members. That's what is very, very important part of patient centered care, taking care of the anxiety of the patients, whether anxiety regarding their physical status, their treatment, their overall impact of illness on their family, and imagine also on the financial impact, which is very important. You never know, suddenly you are there and a patient himself must be thinking, oh my god, I landed into a situation, how my family will take care of my finances. But if I go as a person and I say, don't worry, we are there and we will take care of you, don't worry of the finances. But for that we have to know a person as a whole, that he is worried, he is anxious. That's where we pitch in into this care. Next is involvement of family and friends, which is very, very important again aspect, that we are discussing every treatment plan with the family and the friends so that they are aware where their relative or their near and dear one, it can be their father, their mother, their child, their sister, they have given their trust to a hospital. Imagine somebody's child, they've given the child to the hospital, so they are giving their life to them. So it's very important to discuss with them that what's going on with the patient, answering their queries and discussing with them with the treatment plan. Next is continuity and transition. That's very important again, as I said, once the patient gets discharged or even in the hospital, how they can access the hospital again if they want to. If we give that very proactively, if any healthcare organization gives those pointers to the patients while discharging, how they can take appointments, how they can avail our transportation services, how they can reach us through video consultations, how they can reach us if they have any issues, that calls in for continuity and transition. And please get assured, if you do this, you will definitely, the patient will always will be yours, and the trust that will be embarked between the healthcare professional and the patient will never go away, and they'll definitely choose that healthcare provider than anyone else. And last but not the least, access to the care. So that's what I said, if the accessibility to the hospital or to any healthcare professional will be very easy, definitely everybody would like to go there rather than going anybody else. And most importantly, that trust is very, very important. As I said earlier, there used to be older days, until now there are a lot of people have their family physicians who are 20 years with us. We are the third or the fourth generations going to the same doctor. Why? Because on just a phone call they are available to us. So that's called access to care, that they know that whenever we want, they are accessible to us. So that are the 8 principles of PRICS for patient centered care. Next please just before holding this video, please see this video and just give me a feedback that how do you relate this with this patient centered care. And if we do this, we can definitely get this patient centered care approach in all the healthcare organizations where we are all working. Please start this.
Yes, you can stop.
So this video really touched me because you saw a patient who came with a lot of anxious anxiety that what's going to be with me, why they are coming, and also the other aspect, because I worked in a hospital for so long, we think, why we have to do put tags, put medicines arrangement, take the samples, nobody acknowledges. There is a housekeeping person, there's an engineering person who was there in the, taking care of the lights. Everybody was there, the lab people, the technologists, the pharmacy team, everybody thinks, we are all working, but nobody appreciates. But you saw the F&B person, that everything small, if we do and do as a team together and give that experience to the patient. You saw the patient face when he entered and he was on the bed, and at the end you saw the face of the patient, that he was happy that all these things were done and he was very satisfied. And that's what is the ultimate result of a patient-centered care, that if a team works as a teamwork and if they give that experience, the trust, the patient experience and clinical outcomes all together comes in, which is the next slide, that what you get out of this patient-centered care. That's the question that everybody thinks of. So definitely better outcomes, increased patient satisfaction we all saw, decreased length of stay. Definitely if the outcome will be better, patient has to stay less. Safer environment. As you saw, the patient felt so safe that they have put on bands for me. He felt happy that they are taking care of me, that I am a risk at fall, my ID label is there, my samples are being taken. And definitely it can take to a lower cost of the entire treatment. That are the benefits for the patient-centered care. So I would like to summarize this session by saying that it's patient-centered care is just not a strictly defined process as we have talked of. It's not a strictly defined or structured process, but it's a sequential stages, standardized procedures or interviewing styles. It depends on how and what kind of patients you have, but it has to be a collaborative approach. So it is presented separately in small steps through small people working together, which are in reality they are interwoven. If we are giving even medicine to a patient, it is thinking we are only assuming that a medicine, so it's not a strictly defined process, every small process, but they are all interlinked. It varies from patient to patient. As I said, every patient has its own needs. And then when performing, focally aware of the whole process, not the components. So we have to focus on the entire care and not on the different components, which will help us to give the more better approach to get this care. By this, the session has come to an end. I would just like again to play it again.
Subhashri, audio is not there. Just check the audio.
Patients. At the A patient-centered healthcare system. The country are making choices that define our healthcare system. Are they making the right choices? Or little by little are we drifting toward a system that focuses more on diseases than on patients? At the Alliance for Patient Access, we think patients and healthcare providers deserve better. That's why we advocate for patient-centered care. A patient-centered healthcare system is rooted in a strong relationship between patients and their doctors. They know one another, trust one another, and work together to find the best course of treatment. A patient-centered healthcare system empowers patients instead of making decisions for them. It gives patients and healthcare providers a voice in what treatments, diagnostics, and devices are worth and which are right for them. And it allows patients to access the medicine and services they need when they need them, rather than driving up costs with one-size-fits-all policies that only make patients sicker. What's the result? Costs are driven down and health outcomes improve. Because instead of medical complications, emergency room visits, and late-stage disease treatment, patients have personalized, preventive, and timely care. They can manage chronic diseases and prevent avoidable ones. The system is focused on diseases long enough. It's time to focus on patients.
So this talks all about that I have summarized in the entire presentation, that what are the benefits, what are the benefits to the patients, what are the benefits to the organizations, and what are the benefits to all of us as in healthcare professionals, that what we can give to the world. I would summarize by a very nice quote that I saw while preparing for this talk, that human achievement of although has become very high, but humanness is still lagging behind. So we must adopt an integrated approach. Why? Because integrated approach is twice blessed. Why? It heals the healer as well as the one who has got healed. That's how it is twicely blessed, and it is a holistic approach. More of the time, it is not that something has gone wrong in the patient. It is not one part, but a whole man has to be examined. That's why I would again say it has the whole man that has to be examined, and not only the disease. I would conclude my session today here by this saying, and I hope I could give a basic understanding of this topic and make a justice to this topic. Thank you, everyone. And next is the question answer session.
Thank you so much, ma'am. It was indeed a wonderful presentation. Everyone, we would be opening the forum for question answers. You can drop in your queries or questions in the comment section, and we would be taking the questions from there. So, ma'am, the first question is, what are the key trainings you would like to suggest to increase patient safety and satisfaction in the hospital?
Patient?
Safety and satisfaction in the hospital. What are the key trainings you would like to suggest that employee needs to undergo?
Yeah, so first of all, I would always suggest to go for the soft skill trainings for sympathy and empathy, and to understand the communication skills. What communication skills a healthcare provider has to go on. Then definitely third is about the organizational policies and the protocols that the patient has to understand, and the healthcare worker also has to understand. So these are the three topics I would suggest for the safety. First is the on the communication skill, sympathy and empathy, and the basic roles and responsibilities for the employer and for the patients both. Yeah.
Ma'am, another question is, can you suggest some measures or audit mechanism through which patient satisfaction on clinical aspects can be measured?
Yeah, so nowadays there is a tool called as patient related outcome measures, which are called PROMs or POMs. So you can't do it for the all types of categories of services, but yes, you can start with the outcome driven diagnosis. For example, I would give you on a TKR patients. So you can start with post TKR, post stroke patients. So you can have a checklist made for these patients, and you can ask some questions. For example, post TKR, how is their movement? Is they are able to move properly? Is there pain and reduction in the pain? Is their daily activity of living better than the previous? So these questionnaires you can make a checklist. Similarly for the stroke patients, you can ask about the questions on their lifestyle changes that have happened, their dietary habits that they have improved on post the interventions. So you can start with the satisfaction survey of the patients related on the disease to start with, because every specific disease will have its own questions, which will help you to understand where you can improvise on more.
Thank you, ma'am. Very precisely said. Another question is how are clinical pathways important and correlated with patient satisfaction?
So that's a very broader question, and it'll take a lot of time for me understand. But yes, if you understand what is a clinical pathway, it is a path that you have to follow, and you have a day 1 and day 5. So you need to know everything what is going to happen on day 1 to day 5. So if you analyze those data and you see my patient had to discharge on day 5 but he got discharged on day 6, you compile the data and analyze, and then see what went wrong, why went wrong, what happened, and then you can see why is it correlating with your patient satisfaction. That may be you said the patient that you will get discharged on day 4, but the patient got discharged on day 5, so that's why patient was unhappy. So this was written on your clinical pathway. So that's what you can correlate your pathways with patient satisfaction, and you can analyze the data and see what went wrong and what was good. Also, the positive side also has to be looked on.
So thank you so much for the questions. Are there any questions? There are really good questions. If somebody would like to ask anything.
Yeah, I would like to ask. I'm Pratibha Ambekar. I would like to ask, is this movement happening in India, the patient-centric movement? As far as I understand, it happens only in corporate hospitals. What about the government hospitals? Because there the things are very, very pathetic. Doctors are good, everything is good, the infrastructure is good, but they're still lacking the basic core skills of life, talking kindness, being kind, being humble. So where and in India, the whole population is 80% of the people are in the rural area. So how to go about, is this movement happening in India?
Definitely, this movement is happening in India and across the world. But as you said, yes, most of the population is in rural areas. And that's why I think these kind of sessions help us, because we, the future generation who's in healthcare, should take a command, should take a lead in changing this healthcare attitude and this healthcare strategy to a level where we can come up, where if we get the chance to go into a healthcare in government sector, and if we can get a chance to change uh, their training skills, and if we can imbibe them what is happening in corporate also, somebody has taught them. That's why how they've got those basic things into. So we are the policy makers, we are the leaders, we are the future generation of this country, and it is our responsibility, that is why, to take this movement to the rural areas also. So if any of us gets the chance, we should do this and make our country proud of ourselves and everybody.
So how to be how to, since I'm a trainer and I'm a transformational success trainer and coach, so how would I penetrate into the hospitality industry, into this? Because I'm a soft skill trainer, and I know, and I also have a science background. For example, I can tell you one example where I just one of my near ones, he just passed away because he was diagnosed with tuberculosis, but later on it was when it was diagnosed, he was already in the stage 4 of cancer for prostate. Then the cancer went till the lungs, and they didn't know also. So it's so bad what is happening. Like, I really don't understand, because there's a lot of chaos among the system. That, is it only just making money, or what's there? I just wanted to understand, because I have heard about customer centric. You know, we go to the mobile shops, okay, Airtel stores. There we are treated in a very beautiful manner. But going into the skin of the customer and all this. But are the doctors really going into the skin of the patients?
Definitely, I would say that me being from a doctor family, yes, but everybody has its own experiences, and I'm sorry to hear about your experiences, and that's why now, if you see in Indian healthcare is also evolving, and a lot of corporate setups and non-corporate government is also working very hard towards the quality control. Me being into quality, there are a lot of quality things happening on QCI, National Accreditation Board for Healthcare. They're really working on the tier 2, tier 3 cities where the public and the government hospitals are getting penetrated into. And I think in future, they'll also come up to a level of the basic standards of care.
Thank you so much, ma'am. Thanks to all the participants. I guess we can wrap it up here. Also, if there are any other questions which you wanted us to address, you can drop in your queries at info@medlearn.com. You can visit our LinkedIn page as well and our website, and you can drop in your suggestions, your experience about your any queries. I once again thank you, Dr. Anshu, on behalf of entire MedLearn team and all the participants for such a wonderful session. Also, thanks to all the participants for such great participation, and we really look forward to have you all in the upcoming session really soon. Thank you so much, and have a great evening ahead. Thank you, ma'am.
Thank you, everyone, and thank you to the entire team of MedLearn for organizing it so well. Thank you.
Thank you, ma'am.